Have you and your partner been trying for a baby, but it just isn't happening? You're not alone. Did you know that about 1 in 7 couples struggle with infertility? And in many cases, the issue comes from the male side. In this video, we'll break down the most common reasons why men might have trouble getting their partner pregnant, what tests doctors use, and what treatments are available. Stick around until the end. We'll also talk about other options you may not have considered. Male infertility, or male factor infertility, happens when there's a problem with sperm, either how many there are or how well they function. To get your partner pregnant, you need a normal number of healthy sperm. Problems can include having no sperm at all, having too few sperm, also called a low sperm count, or sperm that don't move well or have an abnormal shape. Have you ever heard of sperm shape and movement being such a big deal? Let me know in the comments. There are a lot of possible reasons for abnormal sperm counts. For example, a blockage in the testicles, often in the vas deferens, which is the tube sperm travels through. Past infections can sometimes cause this. If you've had a vasectomy, your vas deferens was intentionally cut or blocked to prevent pregnancy. This can sometimes be reversed with surgery. Other causes include low levels of the hormone testosterone and certain genetic conditions you're born with. But here's the tricky part. In many cases, doctors can't find a specific reason why sperm count is low or abnormal. Doctors usually recommend testing if a couple hasn't gotten pregnant after a year of unprotected sex. But if you're worried, you don't need to wait. Talk to your doctor. And if your partner is older than 35, testing usually starts after 6 months of trying. The first test done is usually a semen analysis. This test checks how many sperm you have and how healthy they are. You'll provide a sample, which is examined under a microscope. If your sperm count is low, your doctor will probably repeat the test sometimes more than once. If results are still abnormal, they might do additional tests, like blood tests to check hormone levels, an exam to measure testicle size, and other tests to see if there's a blockage in the testicles. The good news? There are treatments that can help. Depending on the cause, options might include hormone treatments to raise testosterone or other hormones that boost sperm production, surgery to remove a blockage, or even reverse a vasectomy. In vitro fertilization, or IVF. In this process, eggs are taken from your partner and combined with your sperm in a lab. Then, a fertilized egg is placed into your partner's uterus. Sometimes, doctors also use a procedure called intracytoplasmic sperm injection. In this procedure, a single sperm is directly injected into an egg. Even if your sperm count is very low or even 0 in your semen sample, doctors can sometimes retrieve sperm directly from the testicles to use with IVF and intracytoplasmic sperm injection. Did you know about these treatment options? Which one surprised you the most? You should know that treatments do not always work. What works for one couple may not work for another. That's why it's important to talk with your doctor about the chances of success, the costs, the time involved, and possible side effects. And remember, adoption and other family-building options are also available. So if you're struggling to get your partner pregnant, know this. You're not alone, and there are medical options that may help. The first step is having that conversation with your doctor. Thanks for watching. If you found this video helpful, give it a thumbs up, share it with someone who might need it, and don't forget to subscribe for more patient education videos like this one. And stay tuned, our next video will cover female infertility and what women can do if they're having trouble getting pregnant.